Happy New Year, and welcome back to my channel. As we begin 2026, we need to talk about Black healthcare, health insurance, and the future of the Affordable Care Act. Because the data shows this moment will shape health outcomes for millions of Black and African American people. Before the Affordable Care Act was passed in 2010, Black Americans faced some of the highest uninsured rates in the United States. According to the U.S. Census Bureau, more than 20% of Black adults under the age of 65 were uninsured. That represented over 7 million Black Americans without health coverage at the time. Lack of insurance meant delayed care, unmanaged chronic illness, higher emergency room use, and worse health outcomes across the board. The Affordable Care Act significantly changed this reality. Between 2011 and 2022, the uninsured rate among non-elderly Black Americans dropped from approximately 21% to about 10 to 11%. According to the U.S. Department of Health and Human Services, this translated into more than 3.3 million Black and African American people gaining health insurance coverage due to the ACA. Much of this gain came from Medicaid expansion and ACA marketplace plans supported by premium subsidies. Black Americans benefited disproportionately from ACA protections. Prior to the law, insurers routinely denied coverage or charged higher premiums for pre-existing conditions. Black communities experience higher rates of diabetes, hypertension, asthma, heart disease, and maternal health complications, making these protections critical. The ACA eliminated pre-existing condition exclusions, required coverage of essential health benefits, including mental health and prescription drugs, mandated preventive services with no out-of-pocket cost, and allowed young adults to remain on a parent's insurance plan until age 26. These provisions narrowed coverage gaps that had existed for decades. However, affordability remains central to access. During the COVID period, Congress expanded ACA premium subsidies, increasing financial assistance and eliminating the income cap for eligibility. These enhanced subsidies significantly reduced monthly premiums, especially for low and middle-income households. Black households were more likely to rely on these subsidies because Black workers are less likely to have employer-sponsored insurance and more likely to work in sectors offering low wages or part-time employment. At the end of December 2025, these enhanced subsidies expired after Congress failed to authorize an extension. As of January 2026, final enrollment numbers broken down by race are not yet available, but the projections are clear and data-driven. According to the Congressional Budget Office, approximately 2.2 million Americans are expected to lose health insurance coverage in 2026 as a direct result of the subsidy expiration. The Urban Institute estimates the impact could be even larger, projecting up to 4.8 million additional uninsured people nationwide, compared to a scenario where subsidies were extended. For Black and African American communities, the impact is projected to be disproportionate. Urban Institute modeling estimates that approximately 1.1 million Black Americans are at risk of losing ACA marketplace coverage due to rising premiums. The Economic Policy Institute analyzed 10 major metropolitan areas and found that more than 170,000 Black adults are projected to lose insurance coverage in those regions alone, along with an estimated 200 or more preventable deaths tied to reduced access to care. These losses occur because Black Americans are more dependent on ACA marketplaces and subsidies. Black Americans are also more likely to live in states that refused Medicaid expansion, including Texas, Florida, and Georgia, where hundreds of thousands fall into the coverage gap with no affordable insurance option. When subsidies expire, premiums increase sharply. In many cases, monthly premiums double. Deductibles remain high. Families are forced to drop coverage, downgrade plans, or delay care. These decisions increase long-term costs and worsen health outcomes. On January 8, 2026, the U.S. House of Representatives passed legislation to extend enhanced ACA subsidies for 3 additional years. The bill passed by a vote of 230 to 196 and included support from 17 Republican lawmakers, signaling bipartisan concern over coverage losses and rising healthcare costs. However, the House vote alone does not restore subsidies. For the extension to become law, the Senate must pass the bill and the President must sign it. Until that happens, the enhanced subsidies remain expired, and millions remain exposed to unaffordable premiums. If the extension is enacted, millions would retain coverage, including over 1 million Black Americans projected to lose insurance without action. If it fails, the uninsured rate among Black Americans is expected to rise again, reversing more than a decade of progress achieved under the ACA. It is also important to understand that the Affordable Care Act was never designed as a complete solution. The law originally included a public option, a government-run health insurance plan meant to guarantee coverage and stabilize costs. That public option was removed because it lacked sufficient votes in Congress. Without a public option or universal healthcare system, Black healthcare access remains vulnerable to political gridlock and policy reversals. Universal healthcare would eliminate these recurring coverage crises. It would reduce racial health disparities, stabilize access to care, and ensure healthcare is not dependent on employment, income, or political shifts. And this is where action matters. Right now, the future of healthcare access for Black and African American communities is being decided. Call your United States senators and tell them to support extending ACA premium subsidies. Let them know that allowing these subsidies to expire will cost millions their coverage and disproportionately harm Black communities. You can find your senators by visiting senate.gov and searching by your state. You can also support organizations actively fighting for healthcare access, including the NAACP, the Urban League, Families USA, the National Health Law Program, and local health equity coalitions in your area. If you live in a state that has not expanded Medicaid, this issue is even more urgent. Without subsidies or Medicaid expansion, many Black families are left with no affordable healthcare options at all. Share this video. Talk to your community. Talk to your family. Talk to your coworkers. Healthcare policy affects everyone, but the data shows it does not affect everyone equally. And before you go, read my blog titled Social Democracy in America, where I break down these systems, the policy failures, and the long-term solutions. The link to my blog page is in the bio, and the data is clear. This is Jax, and this is the Black Metrics.